Welcome to the October edition of Campus Connections. This month is Respiratory Care Month, so today I'm here with Professor Dan Marsala to tell us a little bit more about the Respiratory Care Program here.
Yeah, so the QCC program is actually the oldest respiratory care program in the state, and it's actually the 13th oldest program in the country out of almost like 500 programs. It's a 20-month associate's degree program. We train our students from the very first week they're in clinicals in the hospital, learning the principles behind respiratory care, patient care, all the way from basics of oxygen delivery devices, inhaled medications, up to more complex things like arterial blood gases, mechanical ventilation, and critical care. They have to sit for a credentialing exam, so when they pass that, they get their RRT, which is the registered respiratory therapist, and they can join the workforce.
So Dan, I hear that this is a award-winning program here. You received the Distinguished RRT, Registered Respiratory Therapist Credentialing Success Award.
We've received an award the last 5 years in a row now from COARC, between the Distinguished and the Presidential Credentialing Award. So what that means is for the last 5 years, we've had on average a 3-year track record of at least 90% passing rate for our students when they graduate to take that credentialing exam. One of the last classes that our students take with us, it's respiratory care seminar. We do a really good job in preparing our students for sitting for that exam, so when they graduate, get right into the workforce.
I always hear when I talk to the hospitals in the region, we need more people in every area of healthcare, respiratory tech being one of them.
Yeah, so there is a huge shortage of respiratory therapists. There's actually more respiratory therapists that are retiring from the profession than there are students that are actually going to be graduating from the programs, not just in Worcester, but the whole state itself. Our students actually have 100% job placement rate. Most of them have jobs lined up before they even graduate. After your first year in the program, you can actually apply for a limited practice license with the state. So a lot of the hospitals in the area all actually hire our students with their student licenses, and they can actually start working. So not only is it an opportunity that they can, earn really good pay, but they're being able to put those skills that they're learning in the program to use. It makes them a more well-rounded therapist, so when they graduate, they're ready for that fast-paced environment of being an RT.
I'm now here with some of our wonderful respiratory care students. Can you share your names?
Hi, my name is Hawa Amadou.
I'm Shelle Edwards.
And I'm Merideth Forman.
What's your passion? Why do you like respiratory care so much?
I like critical care. Having to take care and think fast. How many liters of oxygen I give into my patient? Is my patient breathing? Is my patient oxygenating? So just thinking fast, that's what I like the most.
I really like how we make a huge difference, and the fact that we see the relief from the person. Like when you're not breathing, nothing really matters in life.
Being there for somebody in such a critical moment, it's hard dealing with any type of chronic or acute distress, and to be able to be somebody who's there to bring comfort and ease to the situation is a blessing.
All of you must be really cool under pressure, right?
Yeah.
We've had our practice.
And I know it's a hard program. Many years ago, I was training to be a volunteer EMT, and just intubating people, just like, that's hard. What are your goals when you graduate?
Oh, I'd love to work at a level 1 hospital. I want to see every possible situation and be comfortable.
So after I graduate, I plan to work in one of the bigger hospitals here in Worcester.
And I also want to work in a level 1 trauma hospital after graduation. Then I want to take my NPS exam, which is neonatal pediatric specialist. And then I would like to work as a respiratory therapist in the neonatal and pediatric setting.
So you've heard a lot about the respiratory care program and why the students are in it. Now we're going to see the work and the skills in action in a lab, and I'm here with Professor Amy Hogan. Can you tell us a little bit about the lab?
So the lab here at QCC is part of our classroom lab space. Students work here daily, so the lectures are interchanged with practical application. We also have a simulation lab where we can do full simulation. Everything that the students do at clinical, we attempt to do in lab. We have full high-fidelity simulation mannequins. We have partial task training mannequins. The students today will demonstrate intubation and placement on mechanical ventilation, 2 of the skills that respiratory therapists assist in or maintain on a daily basis in the profession of respiratory care.
And we have 2 students that are going to demonstrate their skills here, so can you introduce yourselves?
My name is Denver.
And I'm Bobby. So we'll start with bagging the patient to pre-oxygenate them.
So they're utilizing 2-person rescuer for breathing. One person's holding the mask. The other person is holding the bag and ventilating for the patient. Once the patient's pre-oxygenated and has adequate oxygenation, they'll attempt to intubate.
Insert the laryngoscope. So that's what I'm looking for on the screen right there.
That would have been so helpful when I was learning how to intubate, training as an EMT.
That's the site that we're looking for. I'll take the ET tube, insert it into the airway. If you could pull the stylet. Just that.
About 1 more centimeter in. There you go.
And then we'll inflate the cuff. The patient's intubated.
So we're just assessing for bilateral chest rise and bilateral breath sounds.
So you're actually checking to make sure that it worked.
Because an issue you can run in here is either intubating down the right main stem or intubating in the esophagus.
Oh. So you're trying to get it to sort of breathe in both lungs.
Yes, exactly. So the patient has equal breath sounds. You can see chest rise. So they're intubated
So
properly.
now we place the patient on the ventilator circuit.
So that
Yeah.
can simulate patient pathology. So it can simulate secretions, it can simulate bronchospasm, collapsed lung. So a lot of our equipment is not, it's the same equipment that the students use in the hospital, in clinical. And we have simulators that can simulate patient conditions that they may or may not be exposed to at clinical. So we can provide low incidence, high risk scenarios for students to master before they actually have to work on patients. This is part of the patient safety initiative and requiring specific technologies to be taught with simulation prior to care for patients. And that's something we strive for here at QCC. And now the student can put in the settings that are designated for the scenario that's given within the lab situation. A lot of the things that respiratory therapy students do in the respiratory program are very technical. We work with a lot of pieces of equipment, a lot of software. Critical thinking skills are essential for functioning in respiratory therapy, so you have to have a love of running to the fire and thinking about alternate ways in order to treat the situation. And a respiratory therapist, in their single day of a job, can do right from the first day the patient's born. They can be in the delivery room when a baby takes their first breath of the day, and in that same shift they can work in the operating room or in an ICU where they actually remove a patient from life support and are there for the end of their life as well. So we're there from the first breath patients take to the last breath that they take, and all those breaths in between, trying to support them throughout their hospital stay. Nothing that respiratory therapy does is curative. Everything that we do is supportive. So we're providing patient support through cardiorespiratory support so that the doctor can do his magic, so that the body can heal itself, so that the patient can hopefully ultimately survive. And that's the role of the respiratory therapist, is to support the patient.
Good. Thank you. I want to thank our respiratory care faculty and our wonderful students. Everything that you do is definitely breathtaking. This concludes our October edition of Campus Connections. Stay tuned for the November edition.